Hi, I'm Dr. Zeeshan Rahman. I'm a consultant urologist, kidney transplant surgeon, and uro-oncologist. I'm currently associated with Woodlands Hospital. To begin with, I would like to tell you about the prostate gland in general. So, it's a gland which is located just below the urinary bladder. It's present only in males, and the function of the prostate gland is to add secretions to the ejaculate and to help make the sperm viable, to help in conceiving. So the common prostate problems that we are generally seeing in men, we divide into three different age groups. So the younger age group that present to us is mainly prostatitis, infection-related problems. The middle age group, which is around 40 to 60-year-olds, these are the early prostate growth, which is benign prostatic hypertrophy, and the late age group of above 60 is generally associated with prostate cancers and as well as prostate enlargement. So first I'll talk about benign prostatic enlargement and comparing it to prostate cancer. What you've got to understand is benign prostatic enlargement is basically overgrowth of the gland. It happens in every male, and every male has to go through this process. So the gland enlarges, it causes obstruction, the urine does not pass very freely, and then the patient starts having urinary problems. Now the question arises whether which is the patient which we need to worry about, worry in terms of prostate cancer. There is no specific criteria or there is no specific symptom scoring which gives us an idea of whether a person comes with symptoms as having prostate cancer or prostate enlargement. The main presenting symptoms that the patient come with is poor urinary stream, increased frequency, urgency, nocturia. Now, when the patient comes with these symptoms, it's our job to find out whether we are dealing with just a prostate enlargement or a prostate cancer. Hence, we do our basic screening, which includes PSA, an ultrasound, a uroflowmetry, and based on our digital rectal examination, we decide on whether we need to further take it to MRI level. So to understand prostate cancer, there are three stages of prostate cancer. The first stage is when the cancer is limited to the gland. The second stage is when it's just beyond outside the gland, but it's not gone to a metastatic site. And the third stage is when it's already spread outside. Now, the first two stages is where we generally aggressively treat the patient with the best possible outcome, which is surgery. Now, you've got to understand that there are three different modalities of treatment which we have at our disposal. The first being surgery, which gives us the best results. The second being radiation and hormonal therapy, which gives us so-so results, but those are only for a certain age group of patients, a certain criteria which has to be fulfilled. And the final thing is chemotherapy. So two prostate stages where the prostate cancer is associated with only the gland, or if the prostate cancer is just outside the gland. Today, robotics has made such vast leaps in terms of good oncological outcomes. So what that means is, because the space is very narrow and we need to take out the entire gland, including the microscopic areas of tumor, it's very important for us to visualize those areas and also to preserve erectile function and urinary function. So the problems which a patient generally comes with has after the prostate surgery is erectile dysfunction and urinary incontinence. And today, with the advent of robotic surgery, we are able to decrease incontinence to almost minimal. We are able to preserve the erectile function of the patient, and we are able to send the patient home much earlier than what we used to in the era of open surgery.